Qualified, professional, and compassionate doctors talking real solutions to real health problems.
A good evening, our viewers. Thank you for tuning in to this segment of the Doctalk show. Before I introduce our wonderful guests, I would want to send shout outs to my mom. I know she's watching in her shop in Chai. It's really exciting every evening. This Doctalk show is brought to you by the National Medical Stores and Camelin Men's Collection. In studio, I have two wonderful and exceptional ladies with me, Dr. Sarah and Dr. Lillian. Welcome to the show.
Thank you very much.
I request that you introduce yourselves to our viewers.
All right. I'm Sarah Nakubulwa Tamale, an obstetrician gynecologist. That is a doctor for pregnant women, that's obstetrics, and then gynecology, that is for women who are not pregnant, but also for men who may have challenges in making their wives pregnant. I lecture in the university at Makerere, and I'm passionate about improving women's health and pregnancy outcomes. I'm happy to be here.
Thank you so much, Dr. Sarah. Over to you, Dr. Lillian.
Thank you very much. Hello, everyone watching the Doctalk show at around this time. My name is Dr. Lillian Tumuhaire. I work with Japaigo Uganda as a technical advisor. We work with the Ministry of Health to promote lives of women and children, and we are supporting efforts in prevention of maternal deaths, maternal mortality, and I'm very happy to be here this evening.
Thank you so much. In this month of May 2022, a lot of efforts have been put into pre-eclampsia. Actually, this is the pre-eclampsia month, yeah? And it's going to have a big celebration on the 21st of May from Bale. But before we get to the celebration, we are here to actually speak about pre-eclampsia, because with a maternal mortality ratio of 336 women dying per 100,000, pre-eclampsia contributes 11 to 15% of those deaths. However, as we are going to discover from our discussion, these women do not have to die from pre-eclampsia and also from hypertensive disorders in pregnancy. If a lot of effort is done at the community level, if efforts are done at individual level, but also if healthy systems are working sufficiently. Pregnancy is a risk. And in Uganda, 336 women per 100,000 per year die from pregnancy and its complications. 11 to 15% of these mortalities are due to hypertension and pre-eclampsia. However, in the community, when a woman has hypertension and its complications in pregnancy, they have been attributed to witchcraft. They have been attributed to the fact that ancestors are not happy with the choice of the husband that a woman has. And, you know, maybe this woman was particularly promiscuous. This evening, we have experts from the National Safe Motherhood Committee who are going to help us understand what these hypertensive disorders are all about and why they happen in pregnancy. Dr. Sarah, what hypertensive disorders happen in pregnancy and why are they important?
Thank you very much, Kathy. That is a very good question. Hypertensive disorders are many. The commonest is preeclampsia, where a woman who has not had raised blood pressure before gets blood pressure raised after 20 weeks. Then we have women who have had hypertension before they conceived, and then they get, they continue with the hypertension, and sometimes they get this condition called preeclampsia as well. The preeclampsia, as we said, occurs after 5 months, and these women have something called protein in their urine, which should not be there.
Yeah.
Some of these women can convulse and they get what we call pre-eclampsia, where they get fits as if they have epilepsy. And as you asked, why is it important? It's because of the women who die either every day. For example, in Uganda, about 14 women die while pregnant.
Yeah.
But the commonest, that is 46% of that, so that's like almost close to 7 women, it's due to bleeding.
Yeah.
But then after that, the second commonest cause is due to preeclampsia and hypertensive disorders of pregnancy. And we are also interested in this condition because it causes complications to the mother.
Yeah.
For example, they can fit, as we said, and I actually got a doctor once who fitted on Christmas Day, and we had to hurry to hospital. I had to leave my chicken on table, but I had to go and save a life.
Yeah.
Some of the complications are immediate, some are long-term.
Yeah.
Some other immediate could be that someone's kidney can get spoiled, and in the long run, they may need to support the kidney, which is a very, very expensive process called dialysis.
Yeah.
Then there are also complications to the babies. Babies may have to be delivered premature, but then they may also die. And we feel that the community has a role to play, and yet, as you said, there are misconceptions.
Yes.
So it's important that this issue is talked about, because the community can do something so that we can prevent the disease, but also, even if we don't prevent, we can catch it early and prevent the complications.
Yes.
Yes.
Thank you so much, Dr. Sarah, for emphasizing that preeclampsia, where we have hypertension happening in a woman at about 20 weeks of gestation, you know, and proteinuria happen, is an important issue, yeah, because it causes a death. It also causes complications to both the mother and the child, but also there is something that we can actually do about it, yes. But I'm inquisitive to know what happens. Why do some women get preeclampsia and these hypertensive disorders in pregnancy, and others do not get it?
That's also a very good question, especially given that some people would think it's something else like witchcraft.
Yeah.
It's not witchcraft, my friends. When a baby is made by God anyway, in the woman's body, this baby is supposed to attach to the mother's uterus, mother's womb, and it attaches with the placenta.
Yeah.
That's where the blood comes from the mother to the baby, but also the waste material comes from the baby to the mother. But this placenta in preeclampsia is not well formed. And there are many reasons, but they are not witchcraft. Some of the reasons are very technical about certain balance of chemicals in a mother's body, which we may not get into now. But when that happens, the mother then is at risk of complications, as we've said. But the women at risk are first-time mothers, mothers who have had, if they had preeclampsia in their previous pregnancy. We have mothers who have pressure before they get pregnant, mothers who have diabetes. Those mothers are at very high risk. But then there are those who also have a risk, like if you are obese, your weight compared to your height, if it's very high, and also if you wait more than 10 years to conceive again. Obviously, we don't want you to conceive immediately, but don't wait 10 years, 15 years to get another baby.
Yeah.
It may also be a predisposing factor to preeclampsia. And also mothers who have multiple pregnancy, that is twins and others, 3 or 4 or 5.
Yeah.
Then we also have mothers who have conceived through some new methods where we use a lot of technology called IVF. Yeah. So those mothers are at risk.
Thank you so much, Dr. Sarah, for telling us why preeclampsia is a big issue and also trying to direct the efforts that are actually ongoing, where we are having an entire month dedicated to awareness about preeclampsia and other hypertensive disorders. However, I and the viewers are interested in knowing what goes wrong in a certain woman to get preeclampsia and another person doesn't get it.
So what causes preeclampsia is an abnormal placenta. The placenta is what attaches the baby to the mother, and when it attaches well, then the baby is able to survive, the mother is able to tolerate pregnancy. But when there's an abnormal placenta, then there are different chemicals released which cause issues in every organ of the mother's body. For example, in her brain, it's as if she has some cells of infection, what we call inflammation, and small clots, and these cause the mother to convulse or have fits like epilepsy. That same process happens in every organ, like in the kidneys. It also happens, and that is why the protein is spilled into the urine. And the mother will see some frothing in her urine because it's heavy with protein. So that is what happens. The science behind it is very complicated with a lot of chemicals, but what you have to understand is that every organ of the body gets some bit of reaction as if it has an infection, and then all the different complications will occur from that. I hope you've understood.
Yes, thank you so much, Dr. Sarah. But what if I had 5 women, because we have seen that only 11 to 15% of those that die are from preeclampsia. If I had 5 women, what causes what predisposes to get preeclampsia, and is there some form of protection in certain patients? Are there some form of risk factors, Dr. Lillian?
Okay, thank you very much, Doctor, for that wonderful question. Preeclampsia has been old and has been one of the commonest causes of maternal deaths world over. I would like to say that some of the risk factors are really genetical. We know that the blacks, that research was done in North America, where the blacks stay. The blacks are more at risk of eclampsia, than the Caucasian race. That is a fact. And there are other factors that put a person at risk. We can say which person is at high risk of developing this preeclamptic condition. One of them, if a person has had that condition before, if a person has had raising blood pressures in pregnancy before, they are likely to have that repeated in the subsequent pregnancies. If a person is a first-time mother, has not had a pregnancy before, they are also at risk of having that. If a person has a first-degree relative, a mother, a sister, who has had this condition, that woman is at risk of developing preeclampsia, is at higher risk. If it appears in women who get pregnant either so early or very late, a person who gets pregnant below the age of 20 or above the age of 40 is at risk of this condition of preeclampsia. Others have chronic illnesses like diabetes. If a person has high blood sugars, is likely to develop that. A person who is having, maybe has changed a husband or a sexual partner, may have had children with one sexual partner and now has changed a partner, is pregnant for another man, is actually at risk. Maybe some of the people who think that maybe promiscuity is something like a cause. Sometimes some of these risk factors are existing and they are known. And there are those also other conditions which have a moderate risk like people who suffer disease of the kidney, that is chronic kidney diseases, they are at risk of having this condition. Some people already suffer blood pressure, high blood pressures, and they are treating that condition, they are also at risk. And others have pregnancies with twins. They are also high-risk mothers to develop this condition. Thank you.
Thank you so much, Dr. Lillian, for informing the viewers on the risk factors that they might actually be having that predispose them to preeclampsia and other hypertensive disorders in pregnancy. We are going on a short break, but before we leave, thank you. I would like to say thank you to the national medical stores who distribute medical supplies and drugs across the nation, and the Camelin Men's Collection found at Zebra Plaza on Kampala Road, who have all types of menswear.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Welcome back to the Doctalk Show. I encourage every person, actually everyone who has a sister in their life, a friend who is female, to actually tune in, because this is important, especially if you're going to be associated with anyone who is thinking about becoming pregnant. Yeah. Before we broke off, we were able to discuss what the different hypertensive disorders in pregnancy are, and what causes and what risk factors predispose certain women to having preeclampsia. There are different things that a woman might actually complain of, or things that as healthcare workers we get to see in a pregnant woman that might increase our suspicion for preeclampsia, or actually think that this is definitely preeclampsia. Dr. Lillian, what are some of the signs and symptoms you notice in these women who have preeclampsia that you get to treat?
Thank you very much, our moderator. I'd like to say that for this condition, most of the women will actually be asymptomatic, what we call, they will not present any sign, any symptom. Yeah. It will be discovered later that actually this woman is having this condition or it is developing. So the most of the time, it is a health worker who will tickle you that this woman is actually having this condition. However, as my colleague has already elaborated, that this condition affects all the body systems. It will affect the brain, it will affect the kidney, it will affect the blood vessels, it will but let me highlight some of them. A woman may present with headache. Headache which is not going away. She will swallow painkillers, but is not getting well. That pregnant woman will present with visual disturbances, is having a blurred vision, blacking out vision, and is not having a clear vision. Those are some of the symptoms. Other times, this woman is going to complain of some pain, mostly in the upper part of the abdomen, and is feeling pain that is weird and is not really being explained. Other times, this person is going to present with swelling